nitakungoja Yesu, nitakungoja, 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 ninakungoja Yesu, ninakungoja, 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 nitakungoja Yesu, nitakungoja, 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 ninakungoja Yesu, ninakungoja, ninakungoja, ninakungoja.
A very good afternoon to you. Karibuni sana to Midweek Vibes today. My name is Jasmine Wangai, filling in for Reverend Maggie, who is away. And I'm very excited to be hosting our topic today. And our topic for the day is prostate cancer. That's what we'll be discussing. And to help us gain a little bit more understanding on that, we have our panelist for today and my fellow host here. And what I'll do is I'll ask them to introduce themselves so that in case you're joining us for the very first time, you get to know them, and then right after that, we'll continue. So we can start on my right.
Thank you, Jasmine. Yes. Good afternoon. I am Eunice Njoroge. I am standing in for Charity, who also is taking a short break. And I'm glad to be here, really.
Yes.
And yes, like I said a while back, I am an employee here. I am a wife and a mother. Welcome.
Karibu sana, Eunice. And then we can go to my left.
Yes, good afternoon, everyone. My name is Dr. Jacob Shabani. I am a consultant family physician at Aga Khan University Hospital. And I'm glad to be here to discuss something pertinent to men. Thank you.
Karibu sana, Daktari. We are so glad to have you again. Again, karibu. Right.
So thank you. As Jasmine has said, our topic today is prostate cancer in men. And I think the natural thing is to start with what is even prostate gland and what are its functions in the body. Then we can go later into the cancers and all that.
Yeah, absolutely. Yeah.
That's true. So the prostate gland is a gland that is only found in men. So I think the women can be relaxed and not to worry about diseases of the prostate affecting them.
Yeah.
This gland is found just below the urinary bladder in men. So we call it at the base of the urinary bladder. It's quite a small gland, actually. Its normal size is quite small. Many people call it the size of a walnut, but since we don't know how big a walnut is, it's something like between 10 to 15 grams, so it's quite small, like a quarter of your fist. When it starts enlarging, it's when it goes above 30 grams. But generally, most men will have a gland that is very small. So because it sits at the base of the bladder, in between it, we have the tube that comes from the urinary bladder to the outside, where you pass your urine. That tube, we call it the urethra.
Okay.
This tube is also connected to the spermatic duct at the level of the prostate. So if you are thinking of the prostate at the base, you have something, a tube passing through it, and then another tube passing from the side to join. So the spermatic duct joins the urethra within the prostate gland, and then they form one tube that comes on the outside, the full male urethra. So the function really of the prostate gland isn't a lot, actually. It's one of the things we say in medicine that a man can do without, but it is something that produces part of the fluid that forms the what you call semen. So for men, the fluid that carries the sperm needs to have nourishing fluid, and part of this comes from another smaller gland we call the seminal vesicle, but also we have contribution from the prostate gland contributing to the semen. So that's basically really the function of the gland, not much, but can become quite troublesome as men become older. Yes.
I see, absolutely. Wow, thank you.
From your explanation, I am still concerned that you say it's almost optional.
Like you can do without it.
Yeah.
That's a very good point, and it reminded me, I digress, it reminded me of something I was told when I was seeing a dentist, the wisdom teeth. You know, I was being checked out, and you can remove them. They have no function. They don't contribute much to your dental formula. So hearing there's another thing in our in men's, but I wanted to say in our bodies, but you said prostate gland is only found in men, that you can do without. That's
yes, it doesn't have a lot of function. So the men who have the gland removed can function really well. The challenge is, as I mentioned, the urethra, that tube that passes from the urinary bladder going down the penis to the outside, passes through it. So of course, if you are removing that gland, you have to do some bit of reconstruction to make sure that you have continuity between the bladder and the outside. But aside from that, in terms of function, it doesn't carry a lot of function for men, unfortunately.
Okay, all right.
Wow. Something about creation.
Yes, yes, yeah.
So then, Daktari, what then is prostate cancer?
Okay, so prostate cancer is actually one of the diseases that can affect the prostate gland. I'm sure you've heard about abnormal cell growth. So when this abnormal cell growth happens within the prostate gland itself, we term it as prostate cancer. There are different kinds of cancers in the body. In the prostate, we have one which in medical terms, we say cancers that arise from a gland. And a gland is basically a structure in the body that can produce either an enzyme or hormones. So they produce things that can get into circulation that help us in different functions in the body. So the prostate gland, if you have abnormal cell growth or abnormal growth of the glands within the prostate itself, then we term it as prostate cancer. As a cancer, it's something that happens as we grow, as men grow older. So prostate cancer is really a disease of the older man.
I see. Oh, really? Older man?
Yeah, so the older man.
Okay.
And it shows a difference in the way it develops in different races. So unfortunately for us in Africa, or people of black skin, or people we call people of African ancestry, wherever they are, whether they're in Africa or they're abroad in the US, in Europe, it's been shown that we tend to have earlier onset of cancer, of prostate cancer, and unfortunately also a rapid growth of the same prostate cancer. So it's for that reason, and as we'll discuss later, when you talk about screening for prostate cancer, that guidelines might be a little bit different for us here in Africa as compared to the West. But the cancer of the prostate, if we look at the gland, it's almost shaped like a flower. So centrally, where the urethra passes, you don't tend to get cancer developing at that position. The cancer seems to develop on the outside of the gland, so on the periphery of the gland. That's the commonest area for the prostate cancer to happen. That creates a slight concern in terms of how it spreads outside of the gland. Because it's on the outside, it's easy to spread out of the confine of the prostate gland. So that's one of the problems of prostate cancer, that even before symptoms arise, you could have the cancer spread into other areas because of it being on the periphery.
Yes. I see. Wow. All right. And as you're explaining that, I think there's something we came across, something like prostate gland enlargement, and we were wondering what's the difference then when you say what's the difference between the enlargement of the prostate gland and the prostate cancer itself? What's happening? You've explained well that prostate cancer is multiplication of cells. In enlargement, what's going on? And then the other thing is, for the prostate gland enlargement, if left unattended to for a while, are there chances that it can lead to cancer, to prostate cancer?
Okay. So very good questions you've asked, Jasmine. Actually, the most common problem of the prostate is not prostate cancer, it's the prostate enlargement.
I see.
Prostate enlargement is a non-cancerous growth, a growth that is not cancer. In medical terms, we call that benign. You've heard of the word benign and malignant. So when you have growth of a gland, that is not cancerous, we call that benign prostate enlargement. Sometimes we use the word benign prostate hypertrophy. In medical terms, hypertrophy just means becoming bigger. So really, it's really the same term. And the process of how things become bigger is that the individual cell can become bigger, can grow, or the cells can maintain their normal structure, but also grow in number. So that's how glands usually become bigger. So remember, the basic structure of any human tissue is a cell. So for tissue to grow, for example, like for example, for people who lift weights to grow their muscles, the muscles becomes bulkier usually when each individual muscle fiber becomes big.
I see.
With the prostate gland, sometimes you have the cells themselves becoming big, but the more common kind of growth is when the individual cells increase in number. Now in cancer, this increase in number is abnormal, so the cells look in an abnormal shape.
Yeah.
But with benign enlargement, the cells retain the same shape, so when you look at them under the microscope, you can actually see the boundaries very well.
Yeah.
You can tell that they retain the same structure. The only difference is that they have become more, and that way the gland becomes bigger.
Yeah.
So this benign prostate enlargement or benign prostate enlargement usually then starts more centrally. You remember I said that cancers is more on the outside of the gland, but an enlargement is more centrally. Now, if you think of the bladder sitting on top and the prostate slightly below it, and the urethra, which is a tube that comes from the urinary bladder, bringing out urine to the outside. So any growth centrally will start affecting the outflow of urine from the bladder. And that's where the problem of the benign enlargement starts. So you get this centrally growth, reducing the outlet of the bladder, and then you start getting challenges of obstruction. So these obstructions are what causes the problems of the enlarged prostate, and I can explain a little bit about those problems because they are very common in the older man. So one of the problems of an enlarged gland is actually a situation where you have a poor urinary stream. So men and boys really pride themselves in this. When they go to pee, they would like to have their pee go the farthest possible. But for a man who has an enlarged prostate, sometimes they get such a big challenge that if they're standing at a urinal, their pee cannot hit the urinal. So they have a very poor stream. And they will say that sometimes when I'm peeing, it almost drops onto my feet. I cannot have a good stream. So that's one of the challenges of a benign enlargement of the prostate. The other is a situation where the man goes to pee and he feels he's ready to pee, and he stands there waiting for the pee to come. He waits, and it doesn't come. And then when he's about to give up, then the pee comes. So we call that problem hesitancy. So you are hesitating, you're waiting. Also, men who have enlarged prostate can sometimes get something we call intermittency, where they start peeing, and then the pee stops coming out. And they wait a bit, and then it comes out again. So they pee again, it comes out again. So another challenging problem. Because of that enlargement of the gland blocking the outlet of urine, sometimes also men will get problems of obstruction, and they cannot pee at all. So this is a terrible thing for a man to have. So we call this acute urine retention. So we've seen, it's one of the few times you see a grown man cry, because it's such a painful condition where you have a full bladder and you cannot let the urine out because of blockage. Some of the other symptoms that are common because of this prostate enlargement usually will be frequency, which means going many times to pass urine. Many men usually will go 2 to 3 times in a day, but you might find yourself going 10 times, 7 times. You might also wake up at night to go and pass urine, because when there is an obstruction, it means the bladder fills slowly and you can only pee a little and some is left in the bladder. So you go back again. So you visit the toilet frequently. So any man who has these challenges of waking up at night 2 to 3 times to go and pass urine, or when they pass urine, they feel that they have not emptied the bladder. So they pass and then they feel there's something still left. Or the earlier problems I talked about, which is hesitancy. They go to pee and the pee doesn't come, and when they're about to give up, the pee comes. Or in the worst case scenario where they get acute retention, usually have got an enlarged prostate.
I see.
Yes.
Right. You know, that makes me wonder, what then are some of the known causes for like an enlarged prostate gland? You know, what leads a man to that place?
So the enlarged gland is usually a function of aging. So there isn't something the man will be doing
Okay.
that will be putting them at risk. So as the man grows older, the prostate gland becomes bigger.
Yeah.
And the rate of growth differs. So there are those where the gland grows a lot faster. There are those where the rate of growth is small. It's the symptoms that what I'll encourage the men who are listening to us to look out for. These symptoms I'm talking about. And being free to speak about it when your urinary stream is poor, when you find that you can't empty your bladder completely. You need to talk to your doctor about it. And in fact, we have what we call symptom charts, that when you talk to your doctor, they can give you, and you can actually tell you where the challenge is.
Yeah.
And using that, we have a score to determine on whether these symptoms are bothersome to you enough for us to intervene. Yes.
All right. Wow.
So you've talked about the older man. I'm wondering who is that older man? What are their ages like? So then the younger ones can rest.
Yes.
And at what point do they start to
Yeah.
look out? Because as you say, there's nothing much anyone needs to do. It looks like the risk factor is the age,
Yes.
so to speak.
So that's when you're talking about the enlargement and also a little bit about prostate cancer itself. But the time when the prostate starts troubling men a lot is usually from the age of 40. And most men above the age of 45 will have some degree of enlargement of the prostate gland. So the way to tell is the symptoms that I talked about. So if you get those symptoms, then alert it to your doctor. But then there are ways the doctors can assess for the enlargement of the gland. So when you go to your doctors, there's a test we call the physical test. We do using their finger. They'll insert their finger into the rectum and feel for the prostate, because the prostate can be felt from the rectum. So we call that a digital rectal examination. And if a doctor does this and they are not, we say you are not able to go above the prostate with your finger, then it's one of the signs to show you that the prostate is enlarged. But a much better way to do that is to have an ultrasound done. The ultrasound can give you the size of the prostate. It can also tell you whether there is urine retention, which is one of the things we want to know. If the gland is enlarged, does it contribute to urine retention? Because there are men who have an enlarged gland without any problems of urine retention, and then there are others with not as much as an enlarged gland, but with urine retention. Yes.
Right. Okay. And from your explanation, that happens to be you were talking about the causes for an enlarged prostate gland.
Yes.
Then, because you've made a clear difference between a cancer, prostate cancer, and enlarged gland.
Yes.
What then are there then known causes for cancer of the prostate?
So again, just like the enlarged gland, which is a benign enlargement, prostate cancer also increases as the man grows older.
It has to do with age as well.
So age as well. So again, from the age of 45, usually for prostate cancer, we'll encourage you to discuss with your doctor about screening for prostate cancer, which we'll discuss later on. But age is one of the main things that we worry about when you're talking about prostate cancer. The other one will be a family history of prostate cancer. So if in your family you have either your dad, your grandfather, your uncle who has developed prostate cancer, especially at an early age, and for us early age is anyone below 50, then it means you might be having an increased risk of getting prostate cancer. The other one is actually the African race. It's been shown by people when they are followed up in different races that people of African ancestry have got increased risk of prostate cancer wherever they are. So the people in the blacks in Africa, and for example, the African Americans and the blacks who live in Europe have got an increased risk. So the lineage of the black man seems to have an increased risk of prostate cancer. And that's why
I see.
you find guidelines a little bit different when you're talking about screening for prostate cancer in blacks and in whites.
You know, we were discussing this earlier in talking about race.
Yes.
Saying that we see the number, we're told the more at risk are the black race, like you've rightly explained. And we were wondering, is that just statistics, what statistics have shown, or is there like scientific backup, for lack of a better, can you say it's something in the DNA of a black person that's not present in the DNA of a white person that increases the chances for them getting prostate cancer?
Actually, people are looking into it, and a clear-cut answer has not been seen. So
see.
far is
Okay.
a very clear association to show that in the people of black skin, prostate cancer is very aggressive. The reason for it is not yet elucidated, but certainly, yes, there is that increased risk. So of course there is room for research and people to
I
look
see. Okay.
to look at exactly what is
What
it
it is,
in
yeah.
the black skin that makes you more increased. But that's not only unique to prostate cancer. Diseases tend to have sometimes a ratio link. You have certain diseases that are more common in whites and others more common in blacks. And without quite knowing one gene, it's certainly probably we call it polygenic, or many genes associated with developing that, but the association is there.
Okay. All right.
Allow me to take you back a little to the symptoms.
Yes.
You mentioned an obvious one, the obstruction of urine. I wonder if there are other things that men need to look out for in order to be careful about the risk of either enlarged or the prostate cancer. And I'm thinking about in terms of if someone doesn't have a chance for screening, what can they look out for themselves apart from obstruction, hesitation in while urinating? Or does that mean you're tipping on the boundary?
Yes, so the two conditions actually have got different symptoms or early warning signs.
Okay.
So if you talk about benign prostate enlargement, they are mainly the obstructive symptoms, or we call them obstructive or irritative symptoms.
Yeah.
If you just think about it, it's if something is blocking the outlet of urine, then it will cause some certain challenges.
Yeah.
Now, I did mention that the prostate cancer is more to the periphery of the gland, which means it's further away from the urethra, the midline structure.
Okay.
So it's unlikely to cause obstructive symptoms. So prostate cancer actually, and you wouldn't want to wait for this because it actually means that the cancer has spread out of the prostate for you to get symptoms. So when the cancer when prostate cancer is still confined within the prostate, unfortunately there are no symptoms. But when it moves out, so which we call it metastasis, when it moves out of the prostate gland, then it usually moves to the nearby structures. And one of the closest and nearby structure is actually the spine.
The spine?
Yes,
Okay.
the backbone. And prostate cancer tends to spread quicker to the bones of the spine. So one of the things that men might notice is persistent back pain. And also, just like any other cancer, usually there is associated weight loss. So any man who notices that there are persistent back pain, especially lower back pain, and weight loss, then should be a bit concerned about prostate cancer. Unfortunately, if then you have these symptoms and you go for testing and it's picked at that stage, it's usually spread and it's at a late stage. So we don't want men to focus a lot more on the symptoms of prostate cancer, but rather have a system on where they can be screened for prostate cancer, because there are ways for us to pick prostate cancer early, and therefore intervention can happen.
All right, thank you, Daktari. That's super helpful. And what we want to do now is take a short break, and then, oh, you had a burning question. Did you?
No, I wanted to tell the Daktari that we saw the PSA.
Oh, the PSA,
Yes. And so we thought that that's so obvious. So if I go for tests and my PSA is within a certain range,
there was a value,
yes, I am safe, and maybe I'm safe for the next many years, or am I just safe for that year, and I still need to go for the following year for my screening again or testing?
Yes, so I think that probably forms our next discussion point, the screening for prostate cancer, because there's a lot to discuss about PSA. As you've rightfully put, PSA is one of the tests that we can use to screen for prostate cancer.
Okay.
But let's pick it up after the break, as she
After the
says.
discussion, that's really, we'll be talking about screening, treatment plans, and just some of the physical effects that happens when treatment happens. So see you in a few.
Hi, my name is Kogi Karaoke. I serve with a Fleo as a worship leader. And today I want to encourage you with the words of Ephesians chapter 1, verse 7. It says, "In him we have redemption through his blood, the forgiveness of sins, in accordance with the riches of God's grace that he lavished on us." Especially now during this time of Easter, I just pray we may just focus on these words, that we have redemption through his blood. Amen. Twamwendea Yesu kwa kusafiwa na kuoshwa kwa damu ya kondoo, cha neema yake umemwagiwa, umeoshwa kwa damu ya kondoo. Kuoshwa kwa damu itutakasayo ya kondoo, ziwe safi nguo nyeupe mno, umeoshwa kwa damu ya kondoo. Kuoshwa kwa damu itutakasayo ya kondoo, ziwe safi nguo nyeupe mno, umeoshwa kwa damu ya kondoo. Damu ya Yesu, damu ya Yesu, damu ya Yesu husafisha kabisa. Damu ya Yesu, damu ya Yesu, damu ya Yesu husafisha kabisa. Sioshwi dhambi zangu bila damu yake Yesu, hapendezewi Mungu bila damu yake Yesu. Hakuna kabisa dawa ya makosa ya kututakasa ila damu yake Yesu. Hakuna kabisa dawa ya makosa
yatakasa, ila damu yake Yesu. Kuna nguvu, nguvu, nguvu ya ajabu damuni mwa Yesu. Kuna nguvu, nguvu, nguvu ya ajabu msalabani mwa Yesu. Kuna ushindi, ushindi, ushindi wa ajabu damuni mwa Yesu. Kuna ushindi, ushindi, ushindi wa ajabu msalabani mwa Yesu. Damu yako yaponya, damu yako yakomboa, damu yako yatakasa. Yesu, damuni mwako. Yesu, damuni mwako. Damu yako yaponya, damu yako yakomboa, damu yako yatakasa. Yesu, damuni mwako. Yesu, damuni mwako.
Thank you for watching. Stay safe.
I'm back. Thank you so much for joining us this afternoon as we continue with this discussion on prostate cancer. Allow me to just say hi to a few people that are joining us today. I see Musale Martin, Susan Jerry, Angela Wangevi Kamau, Jacqueline Odor, Isaac Murage, Lilian Mbui Nyawanda, and Agagwa John. And then we have Isaac Murage saying that this is a great discussion. Thank you so much, guys, for doing that as we continue.
So before we took the break,
Yeah.
we had started on screening, and you had ably told us about the DRE,
Digital rectal examination.
DRE.
DRE, yes.
Yeah.
And we saw another one called PSA.
PSA, yes.
So if you can just fill us in a little about that, so that people know if they need to screen, they have some knowledge to it. They can name a name and make a decision which one works for them. Although we had actually seen that PSA is more, what's the word?
More recommended.
More accurate
More
in terms
accurate,
of time.
accurate is the word, yes.
Yes, so screening of prostate cancer is something that over the years for us in the scientific world have had back and forth of what is the rightful approach and how do we, which tool to use or which test to use. And that's because, as explained earlier, there's those differences due to race, where you can have a cancer that is very aggressive and in people of black skin, but not as aggressive in people of other races. Now, DRE or digital rectal examination is a good way for the doctor to feel, but it creates a bit of subjectivity. What I feel and another colleague feels might be a bit different, although there will be guidance on try to look for the smoothness of the surface of the prostate gland, and if you feel that it's not as smooth as is expected, then you'll be raising a concern that this gentleman might have a cancer. So it's
Doctor,
yes.
let's pause there. You talk about smoothness and feeling and all that.
Yes.
Sounds like a very invasive sort of examination. And
It already is, by the way. Let's not go into. I already.
So it's an intimate exam. It's if with the rightful explanation and preparing the man, it's also not a painful exam. It's uncomfortable, yes, but it's not painful. And it doesn't take long. Usually
Yeah.
2 to 3 seconds and somebody will be able to fail. So it's something doable. So we shouldn't scare the men
Okay.
going through it. But a different, probably a better way is to do a blood test where we measure an enzyme that is produced, a substance that is produced by the prostate gland. We call it the prostatic surface antigen. So that's the full name for PSA.
PSA.
But we'll call it PSA. And depending on how high the level of this enzyme is, then you will be able to say that you are at an increased risk. So because it's something that is naturally produced by the prostate, any condition that changes in the prostate makes it go high. But cancer, prostate cancer tends to give us the highest elevation. So, for example, for a man between the age of 40 and 45, this value, normal value, will be between 0 and 2. Yes. So when you start getting values above 2, then we get concerned. And typically for the non-cancerous elevations of PSA, for example, even the benign prostate hypertrophy can make it go a little bit high. You can also get an infection of the prostate gland. We call that prostatitis. Now, this is a much more commoner issue for the younger man because it carries a sexual transmission risk. So for prostatitis, that value can become a bit high, so maybe between 2 and 4. But for cancers, usually the values are sometimes even in the hundreds and thousands. So we have something we call a gray zone. So for values between 4 and 20, the doctor will discuss with you whether you need to be screened or to be tested further to determine if you have prostate cancer. Remember, the PSA is not, we call it, is not diagnostic. It does not tell you that you have prostate cancer. It just alerts you to the possibility of prostate cancer. So when it's elevated, then another procedure is done. So that procedure, we call it a prostatic biopsy. We take a sample from the prostate gland and analyze it in the laboratory. And this is what is going to definitely tell us whether you have prostate cancer or not. So typically when a man walks in for screening, we tell them that you have this test that has been found to be, if at a certain level, to be showing an increased likelihood of you getting of having prostate cancer. And if this test then reaches that threshold, then we'll send you for another more invasive test, a further test, which you call a biopsy. And once we do a biopsy, then it's the one that will definitely tell us whether you have prostate cancer or not. So guidelines in terms of screening then has varied because over the years in countries that have been screening a lot, for example, in the US, they have actually followed up a series of men who've been screened by PSA, and they have seen in certain situations where they had men who had elevated PSA, but when they went for the biopsy, the cancer was picked. Unfortunately, the cancer that was picked is the one that grows very slowly, that would otherwise will not have led to complications in their life. And yet we are doing invasive procedures for them. We are worrying them more by telling them that you have a cancer, because once you know that you have a cancer, your anxiety level changes. And if this cancer would not naturally have led to complications early or even death, then it's probably no need to say it. So that was some of the concerns and the controversy that arose with the PSA testing. On the other side of the coin is that in people of African race, this cancer grows rapidly and causes complications quickly. So if we do not screen, there are chances that you might be lying on a cancer that will cause the death of that man. So it's these controversies in the scientific world that has led to a recommendation or guidelines for us doctors and even out there that every time we are to screen for a man for prostate cancer, we sit down with them and tell them the benefits of early screening and the disadvantages of early screening. So one of the benefits, of course, of early screening is that you can pick a cancer at a very early stage and offer you treatment that will not lead to complications. The slight disadvantage of early screening is that you might pick a cancer that is so small that will not have caused any problem for you anyway in your lifetime. But because now we've told you that you have a cancer, then obviously your mental status changes, and as doctors you have an obligation now to treat that cancer. So that is really sometimes a controversy. But when you look at our national guidelines, because of this, the scientific body and our national guidelines tend to favor the early screening for men of black skin because of the concern of the rapid and worsening prostate cancer scenario. But yes, when you go to your doctor will discuss with you. There's this screening test called the PSA, how it helps us determine on whether you need a biopsy or not. And if you need a biopsy, what are the cutoff levels that we should use?
Yes. You know, I feel like I'm that Kenyan or whoever. Let's say, for instance, if I was a patient, if I heard the word cancer, you know, even if it didn't have an effect, you know, in my lifetime, I'd go paranoid. And it also makes me ask, is there such a cancer, you know, that can be found in your body, but it will cause no trouble? Because for me, the word cancer, it just throws me off, and I know.
Ati daktari alisema niko na kansa lakini nisijali.
Yeah,
What's that?
too sour.
How
You
is
know what
that?
I mean? So are there such cancers? And okay, the fact that you said yes, the fact that you said it's a cancer that wouldn't cause trouble, I guess the answer is yes.
Yeah, but umesema in African,
Well, and that's the
men,
challenge, is that even when you're saying we
Yeah.
have this cancer that will grow very slowly and might not cause you trouble in your lifetime, you will not be sitting back and doing nothing. So you'll be doing something we call watchful waiting, which means you still need to go and see your doctor and we monitor it and say, it was this small this year, what about next year, how has it grown? So there's still a lot of anxiety with this constant monitoring when you are told that you have a cancer. So for that reason, usually you'll find that most doctors, once we have a sitting with our patients, or we like to call them clients because at that time they're not unwell, that will advise them that if we test and we find that there's something we are saying, the natural thing to do is actually to aggressively follow it up and get it treated, especially because of our African skin, where this cancer can, for example, grow very fast.
Is the screening annual? Is it one of those that you would say
Yes.
people need to do annually?
Yes, so if you then opt to screen for prostate cancer, the best screening test is the PSA, and it's recommended that you do it annually.
Okay.
So you have cutoffs for that, as I mentioned. For majority of people, if you are 65 years and below, any value less than 4 is okay. So when you get that, we tell you that's normal. Let's see you again next year. So when it's between 4 and 20, then we call that the gray zone, and there are different ways to follow up a person who is in the gray zone. So one of the things is that you can screen at shorter intervals. So instead of 1 year, I can say come back again in 3 months. Or we can do certain other tests for that PSA. There's different biochemical things you can check, like something we call PSA, free PSA. So very technical things, but you can actually check how that PSA is rising. There are people who then they say maybe you now need an ultrasound to look at your prostate and see if there's something suspicious, or another imaging test, like for example, something we call MRI or magnetic resonance imaging, so that we can see whether there is something there that we should be concerned about. But for values above 20, most doctors will say this is a high cutoff, this is likely to point towards prostate cancer, and therefore we advise you to go for the biopsy. Now, the biopsy is, as I said, done where you take samples from the prostate gland, and so that we don't go blindly and take very many samples. With technology, you can have what you call ultrasound guided biopsy. So when I'm doing an ultrasound, I am seeing where the prostate does not look normal, and that's the area that I target and get a sample from there. Because you don't want to hit and miss. You want to make sure that if you take samples, you are going to take it from the area that is affected.
All right.
Yes.
Thank you, Daktari.
By the way, I've got a question. I'm wondering, for the men, say 55, what's the prevalence rate?
So in our country is actually the second most common cancer in men. So that's why you see we are not quite reliant on the guidance from, let's say, America, where it's not as common or it doesn't pick cancer that kills. In our country, it's the second most common cancer in men. So it's something that is of concern. As and also quite high in the cancer killers. So I think if it's not third, maybe even second in the cancers that kill men in our country. So it's not something that we would want to ignore, and that's why you see we lean more towards advising men when they reach the age of 45 to have that discussion with their doctor, and if they have certainly increased risk factor like family history, then they should screen. But then for the others, I'll have a discussion with you and tell you these are the pros of screening, these are the cons of screening early, and then we make a joint decision together. Yes.
Thank
All
you.
right, thank you. Daktari, let's talk about the treatment options.
Okay.
And last week we had a discussion on lifestyle diseases in relation to cancer, and food was one of the things we talked about. So as we're talking about treatment, there's this narrative going around about I think they're calling them cruciferous vegetables. So I think that's quinoa, broccoli, cauliflower, and they say that they're very helpful in killing cancer. Is that true? So yeah, you know, what are the treatment options? Is it men eating lots of these veggies, or you know, what options do they have?
Good. So when you're thinking of measures that one can do to prevent prostate cancer, and especially about diet and lifestyle, it's the general things that we spoke about last week in terms of living healthy and having enough vegetable and fruit, because that basically mops up not only concerns of prostate cancer, but general health in general. But there are foods which have been looked at and said, are there particular foods that if you take, you might have better protection from prostate cancer? Unfortunately, the evidence is not very supportive of that approach. It's not harmful, for example, to eat the cruciferous vegetables and pumpkin seeds, which are one of the things that have been mentioned to be healthy, or tomatoes, because there's a substance in the tomato we call lycopene, which is being looked into to see whether it helps prevent prostate cancer. So the science is still out there. There might be a benefit, but it's not very concrete. So we cannot recommend and say that if you want to keep prostate cancer away, men should eat a lot of tomatoes. But I would say for men who are concerned about prostate cancer, is that have a discussion with your doctor so that you can get the appropriate screening done for you, and then follow this up regularly, like when you say annual screening. That's where the real benefit lies. And keeping a healthy life, generally, it's about living a long life. So you don't want to prevent prostate cancer and die of diabetes. So it's good to eat healthy so that you don't get the other things that cause problems for you. Yeah.
Ask Jasmine the mathematics, but I will spare her.
Okay.
Thank you for sparing me. Let's talk about people who already found to have cancer. You know, what in the medical industry outside there, what are the treatment options? I think that's where we need to head. Yeah.
So those unfortunately found to have cancer, the very first step actually is a process of what we call staging of the cancer to find out, is it localized only in the prostate? Has it moved out of the prostate to adjacent areas? or has it moved far beyond the prostate? Sometimes you have prostate cancer going to the spine, like I mentioned.
Yes.
And the treatment options then will vary depending on the staging of the cancer.
I see.
It will also vary depending on the type of cancer. So there's when the sample is taken to the laboratory, there's something we do which we call histology, and there are some certain cancers which are more aggressive and others which are not as aggressive. So the treatment decisions are judged on based on those, what you call the type of cancer and the staging of cancer. Now, if the cancer is confined in the prostate and it's a very small cancer, the treatment option could include what you call localized radiotherapy treatment. Now, radiotherapy means you use X-rays to burn the area that is afflicted by the cancer. Now, if you target it only to that area, then you'll have the normal prostate gland retaining its function, and you don't cause damage to adjacent tissues. So that is something that is available when cancer is picked at a very early stage. And that's some of the treatment options that have been used by prominent people who have picked it early and gone for that kind of treatment. We call it brachytherapy.
Okay.
In the hospital that I work in, we are looking at options of bringing those kinds of treatments so that when cancer is picked early, it's treated with localized treatment. Sometimes if it's just within the pelvis, which means the organs around where the gland is sitting, then you can also have what we call radiotherapy that is delivered in a wider area. So we call that external beam because it's not internal in a small area. And since you are radiating a bigger area, there are chances that you could damage other organs around there. Because remember, radiotherapy does not know what is a cancer cell and what is a normal cell. It just kills everything around there. And therefore, when you have the cancer advanced and you go for these treatments, the outcomes are not as good, because if you are to irradiate a bigger area and do it many times, you might have more complications. The other treatment that has been found to be useful for prostate cancer is treatments that reduce the amount of testosterone. The reason why prostate cancer is only found in men is that it actually feeds on the male hormone we call testosterone. So parts of its treatment is medical treatments that reduce the effect of testosterone. And in the older days, people used to have removal of the testis. The testis is the biggest gland that produces this testosterone, and of course, if you remove the testis, then you create other challenges after that and complications. But even the medical treatments have got challenges of reducing the amount of testosterone, and I've got what you call a feminizing kind of problem effect. So men who undergo these treatments sometimes develop hot flashes, like women in menopause. They have enlarged breasts as a result of the treatment. Yes.
But even there, that the treatments, as you say, in totality, they seem to just have some critical side effects. Is that so?
Yes. So there are effects that a man will not appreciate, but remember where they are coming from. If you're told you have a cancer, it means these treatments are potentially life-saving. And with advancements of science, the side effects of these treatments have become less and less. But more common side effects of this treatment, as I mentioned, is to do with the radiotherapy process. You can get burns, you can get destruction on normal cells, but also because we are doing what you call medical castration, then we are completely getting rid of the male hormone, testosterone. So men after the prostate treatment can become impotent, which means they lose the ability to have an erection. And the erectile dysfunction accompanying that is sometimes a challenge. Sometimes in men where the cancer was picked very early and they have the prostate removed, it's not the usual process, but you can get something we call retrograde ejaculation, which means when you have an ejaculation, the semen doesn't come out, it goes back to the bladder, and that cannot be satisfying to the man in the whole sexual experience. The other challenges are to do with the fact that radiotherapy sometimes also affect blood cells, not so much. And also the worry and concern that you have cancer creates a lot of anxiety and
Yeah.
depression as you're going through this treatment.
Yeah, I think there's an effect we were talking about earlier, and
Yes.
how you can tell us they were calling it incontinence. Did I say that right?
Yeah,
and
urine
and
incontinence.
how common is it after treatment? Probably you can
So
make a comment on
again,
that.
not a very common effect unless you've removed the prostate gland itself. And sometimes then you lose the mechanism of we call it a sphincter. On the outlet of the bladder, there is a string of muscles that contract and make sure that the urine doesn't come out unless you're ready. So any treatments that target around that area, sometimes the effect of radiotherapy, sometimes the effect of the surgical procedures, then you get incontinence. It's not now a very common feature because of the advanced treatments that we have with prostate cancer.
Okay.
But what is common will be the feminizing features because of the need to lower your testosterone levels. So the erectile dysfunction is a much more common concern with men treated for prostate cancer.
So Eunice, I don't know whether that question is in your mind. After these after treatment effects, when people get them, is that it for them, or is there a way to rehabilitate right after this? Okay, probably we've managed to do away with the cancer, but then the feministic features they're talking about, erectile dysfunction. Are there ways to manage that, or is that it after treatment?
Yes, so it's not all doom and gloom. So even for men who are on treatment for prostate cancer, there are medicines that you can use to even manage the breast enlargement. But for erectile dysfunction, we have very many medicines available for that can help them. And for very severe cases, we have implant devices, but most of the time you have medication that we use to mitigate that. Now, the treatment usually for prostate cancer is not lifelong. For many men, the treatment can be a year. Majority of times we see people even going for treatment for 5 years, and then we stop the reduction of the testosterone medication. So it's a period of time, and then once that treatment stops, of course, you go back to your...
Go back again. All right.
Yeah.
Wow.
Dr. I wonder if you've, in your life, have come across any communities that have sort of myths around this disease.
Yes, so some of the myths is actually what people talk about in terms of foods. So the myths about tomatoes and pumpkin seeds being able to promote prostate health. There's nothing wrong eating these foods because, of course, they are rich sources of vitamins and minerals, and they're healthy to eat. But we shouldn't raise our hopes so high until the science comes and tells us that they are certainly helpful in terms of prostate. But I think the main myth for the man is the man who is fearful to express these symptoms early. And that's sometimes the tragedy with prostate health, is that you have a lot of men who suffer silently, and they don't say, for example, when they have the urinary symptoms, for example, and think it's cancer, and it's not. As I mentioned earlier, most of the urinary symptoms are to do with just benign enlargement, which is not a cancerous process. But even when you have some of these challenges of chronic back pain or unexplained weight loss, as a man, you should have this checked early, because there are good treatments now available. There have been prominent people in our society who've been diagnosed with prostate cancer at an early stage and gone for early treatment, and they are now living a fulsome life.
Absolutely.
Yes.
Absolutely. Wow. Thank you very much. Eunice, wouldn't you agree that was a very helpful discussion?
Oh my goodness, that is so helpful, educational, enlightening. And why I'm really happy about it is I feel like there are all these talks, conversations, information about women, what we need to do with our skins, what
Yes.
we need to do with our hair, what we need to do with our nails. But men's information is quite scarce, and if it's there, people hardly look out for it.
Absolutely.
So I feel like this
Yeah,
is
it was
really nice
helpful.
and important.
Yeah,
Yeah,
yes,
and,
yeah.
and we want to ask that you invite men around you and your dads, your uncles, your older brothers to listen into it, really, because like the doctor has said, we can save a life. And he says you may not quite catch the prostate cancer, but you could die of something else if you're not looking out for your health, so to speak. Yeah, so thank you. Thank you,
Correct.
Daktari, and thank you for being available to us once
Absolutely.
more.
Once more,
We
yes.
do not take it for granted. We are really thankful that you
Yes.
could come today.
Thank you.
Dr. One final one. A word to men in relation to prostate cancer.
So I'd like to urge men, this is a time to take a proactive approach to your health. Go for a discussion with your doctor so that you can be guided on how you can screen for prostate cancer. And within that conversation, you can have a discussion on how you can screen for other diseases as well. Diabetes is on the rise, high blood pressure is on the rise, and other cancers are also on the rise. And most of these diseases are silent at an early stage. With cancers, you do not want to wait for symptoms. So although I said that some of the symptoms of prostate cancer is weight loss and unremitting backache, you don't want to wait for this, because once you have this, the horse has already bolted, and the treatments will be not only expensive, but will also carry increased risk of complications. So early screening and early treatment is the salvation for prostate cancer. So please have a discussion with your doctor so that you can get your cancer for the prostate being screened.
Right, asante sana Daktari. And thank you guys for tuning in and joining us today. I hope this discussion has been helpful for you. I know we may have said it's prostate cancer in men, but this information is much for you as it is for men. So please share this link with other people who are not tuned in. Let's create awareness about prostate cancer. So that's it today from our desk today. An absolute honor and joy to have been joined by you. Have a great week.